Greetings, this is Ty Brown with AthleticDirectorU. I'm joined by Dr. Monique Marsh-Bell, who's the Assistant Athletics Director for Mental Health Services at Baylor University, and Dr. LaKeitha Poole. She is the Director of Student Athlete Mental Health at LSU. Greetings, ladies. Thanks for joining us.
Thanks for having us.
Thank you.
Now, if you don't mind me calling you Monique and LaKeitha, I would feel like the conversation would be a lot more comfortable if I did that. Are you guys okay with that?
First name's fine. Yeah.
Okay. All right. Thank you. Want to talk to you guys about mental health services and athletics. Monique, you come from a background, you worked at the counseling center over at Baylor for a few years before athletics hired you in. LaKeitha, you were in, I guess, the Department of Multicultural Affairs over on campus at LSU, helped create mental health services for that organization, that department. So you guys have dealt with people who were just students and then people who are student athletes. And I think there's some similarities, but there's some big differences in the two. And the first question I'll ask both of you, first you, Monique, is talk to me a little bit about the difference in experience. And I guess time commitment is one of the big ones from working on campus and then now that you're working in athletics.
Yeah, so when I was on campus, our counseling center was open 8 to 5, and those were the hours that we provided services to any student athlete, or just regular student on campus. We did run a 24-hour crisis line, but because there were multiple providers, you would have like 1 week of on-call in an 8-week span. So the time commitment wasn't as great. In athletics, even though the population is smaller, so I only have about 500 compared to the amount of students you have on campus, we know that our athletes' schedule is very different. And so the 8 to 5 model really doesn't work for them. So sometimes sessions are really early in the morning or late in the evenings or even on weekends, whatever it is, to make sure that we are providing them services at a time that they would be able to utilize those services.
Yeah, similarly, our area over in multicultural affairs was 9 to 6. So we just did that to, again, fit with kind of a student model of when they might be available. But obviously making that switch over to athletics, much different in that, just like Monique said, you have early practices, you have lifts in the morning. And so having to create services kind of around that has become the goal or really essential in order for us to make sure that we're available for our students. And then we function sort of on call 24/7 in a way, in that, students can reach out to us directly, which is way different than when you work on other areas of campus. Like Monique said, when 5 o'clock comes, you get to go home. And if there's a crisis, there's a line for that. In this instance, we're the line. And so that is definitely different. And working in athletics, it's sort of being accessible and people having access to you all the time.
Right. Yeah, that's interesting. I also want to ask if you guys could, for me, talk about your. I guess there's different schools of thoughts when you talk about psychology and counseling. There's different positions, and I wonder if you guys could tell us the difference between a clinical psychologist, a sports psychologist, a clinical social worker, a counselor, and then I think there's nuances in between each one of those within their specific disciplines. Can you guys talk to me a little bit about that and where you guys fall on these spectrums?
Sure. I'll go first. Okay. I think just in thinking about the differences, and this is the way I describe it based on obviously the school of thought that I'm in. So first I'll say I identify as a licensed professional counselor, so an LPC. And so my master's degree was in clinical mental health, and then my PhD was in counselor education and supervision. And so that's the model, I guess, that I use. And that approach is centered specifically around wellness-based and sort of strength-based models and being able to help a person achieve their goals based on what they have internal, their environment, those sort of things. When you start looking at other schools of thought, while they're all based in psychology, which is why they work well together, a clinical psychologist, and from my approaches things from a medical model, really looking at, what are the things that are playing into someone's dysfunction, both physically, mentally, emotionally. When you say sports psychologist, that's more of an emphasis. That's how I view it, is that you're a psychologist still in practice clinically, but you have an emphasis on performance with the combination of sort of mental health work. Clinical social workers, I view them as their advocacy, because that's what social workers really do. They work really, really intentionally around advocacy models and being able to make connections between the community and a specific person, and really being able to offer resources. And I think that covers all the ones you mentioned. And a counselor, like I said.
Right.
So I would consider myself to be a clinician, a counselor.
Right. Monique, you have anything to add to that?
Yeah, so I am a clinical social worker, or clinical psychologist. We just hired a social worker. I've been thinking about her a lot. I'm a clinical psychologist, so my master's and doctoral degree are in clinical psychology. And I think LaKeitha explained it very well. Maybe not as much medical, but we definitely look at things just a little bit differently. We want to explore how people's thinking, feeling, and behavior are interacting, and where that stems from and how it impacts how they function day to day. Like I said, we just hired a clinical social worker, and so she really is going to focus on the case management, the crisis management, making sure our student athletes have access to resources that neither she or I can or do provide to our student athletes. So those are some of the differences. I've talked to you, Ty, before about the sports psychologist and kind of the emphasis on performance and the emphasis on improving our student athletes' mentality and mental abilities and skills specifically related to their athletic performance.
Right. I wonder, the person you just hired, the things that she will be doing, were you doing those things too in your role?
Yeah, maybe that's why I said that I was a clinical social worker, because I've been doing it all until we just hired her. And she started 2 weeks ago, and I'm so excited. But yes, I mean, I've been doing the case management. I've been doing the crisis work for the time that I've been here as a staff of 1. And so now we have doubled and we're a staff of 2. And I'm really excited about that.
That's excellent. Now, LaKeitha, you've had a few people working with you, I guess, for a little while now. What does your staff make up in terms of mental health services?
Yeah, so when I became director, that was literally one of the things that I required in getting into the role. I knew how much help I needed just based on the number of student athletes we had. So I hired 2 folks, and one is an LPC like myself, and he is our assistant director. And we have a clinical social worker on staff as well as our third person. And so the combination of those 3, and I think we all have our unique, emphasis areas outside of even sport. Our assistant director, substance abuse and use issues is really his forte. And that really has helped us as a department to have him. And then kind of like Monique mentioned, by having a social worker on staff, you have somebody who can help with making those resource connections across campus. And then case management to process folks through, the clinical process that happens sometimes for cases that have to leave our department. So having the 2 of them has been a blessing for sure.
Right. Yeah, it's interesting. You think about the services you guys are speaking about for the group of student athletes, or even, I guess, LaKeitha, when you were working in Department of Multicultural Affairs, or Monique, when you were working in counseling services on campus at Baylor. I wonder about schools with less resources, right? Division II, Division III, even FCS or even FBS schools that possibly can't afford to have a multitude of people in their department. How do they get along in terms of like providing services for student athletes? I mean, obviously they would probably partner with whoever they have on campus or in the community, but I know, LaKeitha, you work with a program and with I think there's a psychologist out there you work with that probably provides some of those services. Talk to me a little bit about that.
Yeah, so Dr. T.M. Robinson Mosley and I have really made this sort of a passion of ours in trying to figure out how to provide resources to schools that don't have them. So she is a clinical psychologist, and we have worked together with a couple different schools and really hoping to grow that area for our HBCUs, Hispanic serving institutions, and even some of your smaller collegiate athletic associations. So we have an upcoming presentation in July that we're going to talk about mental health services and how to create them, how to provide them with the Central Intercollegiate Athletic Association, the CIAA. And so really it's about, and you mentioned this, Ty, figuring out how to help them figure out what resources are already available so that they're not trying to stretch budgets or find folks. Everybody's not fortunate, like schools like LSU and Baylor, to have in-house people in their athletics departments. And so being able to help them figure out, okay, well, can we get from your counseling center a liaison for athletics that's maybe available a few times a week? And that's a start than having nobody. And so really figuring that part out, or even contractors. So a lot of times you'll see smaller schools reach out to local clinicians who have maybe a background in sport or even just a really strong clinical background in mental health, to be able to offer resources. And so then they'll create a contract with the university or with the athletics department to then provide those services, whether they're, it's counseling, substance treatment, groups, anything like that. They usually are able to go through a contract and create those opportunities. So those are usually some of the tips that we offer, just in thinking about ways to get started.
Right. Now, student athlete mental health has been a topic of discussion amongst athletics directors and the athletics industry, the college athletic industry, for the last 5 to 10 years. Top priority, and it's becoming more and more important over time. I wonder, you guys have been practitioners for the last 5, 6, 7, maybe 10 years amongst both of you guys, maybe 15 combined. I wonder what have you seen evolved? I mean, how have you seen this whole industry in general and specifically in athletics evolve since you guys have been in the industry, since you guys have been practicing, I guess?
Yeah, well, I think being on campus, one thing that we saw was the growth and utilization of mental health services, and that's not specific to just college students. That includes our college student athletes. And so the program that LaKeitha was actually talking about, where you partner with the counseling center and just have someone in athletics for one afternoon or 2 afternoons a week, is really how I got started. And at first, it was this question of whether or not my time would be filled. Would I be just sitting over there at a desk, kind of twiddling my thumbs? And when I got here for that one afternoon a week, my time was jam-packed. And so we sometimes don't know what we need until we have that resource. And then when it starts being utilized and we realize, not only do we need more than one afternoon a week, we need more than one person full-time, and it continues to grow. So I think some of these things have been there, but because we haven't had anyone in this position or anyone in this role, we haven't really known that these things were happening at the rate that they were, and our student athletes were dealing with mental health issues at the rate that they are. So because of that, now we know that we need to continue to grow these programs.
Yeah, definitely. I agree with Monique. I think it's sort of the if you build it, they will come model. And so once you have more folks available, you will see that there is this growing interest in people being able to erase the stigma around mental health, seek those services, and even just explore kind of what its use can be for them, particularly with athletes in sport and making them better performers out in their sports. And so the great part is that's been supported, or I feel like it is, at most levels, right? The NCAA has best practices now around mental health, and most universities now have someone on staff. And the NCAA has required now that everyone has someone available, even if that's not in-house in the athletics department, but have that person identified. So I think a lot has changed for the better. And my hope would be that it will continue to grow positively, and that the need will, continue to be something that's prioritized.
Right. Now, Monique, I've had you on the One Question Leadership podcast, talking about what you do there at Baylor and your progression in the space. One thing I asked you then, and I'll ask now, you guys obviously are African-American women, right? And there's a stigma in the African-American community of like weakness, of that's not being tough. Do I really need to do that? Or I'll go home and talk to my family. They'll be my counselors. Does the fact that you guys are African-American women make it easier or have you found that it makes it easier for student athletes who may be African-American or people of color walk in the door for you guys?
Yeah, like I shared last time, the student athletes that come to my office, and that's the first time they're meeting me and they're surprised that I'm Black. And and I think that really opens the door for them to feel a little more comfortable. Even now in the times that we're dealing with, as I'm doing mental health screenings, I'm asking them how they're feeling about what's going on in our society with the racism and police brutality. And I feel like I can have that conversation with them a little bit easier because I'm a Black woman and, can make that connection with them. So I definitely think there's something to being an African American in this space and being able to connect with our Black student athletes.
Right. LaKeitha, now you come from a background in Department of Multicultural Affairs, right? Being in psychology, working in that department on campus. So I wonder the conversations on race, and we're here in 2020 with the pandemic, and we're talking about people expressing frustration over police brutality and over generations of racism. So I imagine the conversations have been ongoing in terms of your position and even more now.
Yeah, I feel like culture and identity are intricately tied to mental health. I
Right.
don't know that you could talk about mental health without having a space to address identity and racism and prejudice and all these other things. And so I think being able to then bring that into a space that already is supposed to feel sacred and private and confidential, and then look across the room from somebody who looks like you, who, even if we have totally different upbringings and backgrounds, there's just this basis of support and at least understanding where a student doesn't have to feel like they have to come in and put on airs to be something when in therapy, that's just not what's supposed to happen anyway. And so I think that it definitely helps to be a person of color during this time, to have other students, Black students, or even non-Black students, to come in and sit across from somebody who looks like the folks that they're seeing, at this time be victimized, and have them offer to them too some form of support or a place to share and discuss feelings. So I'm happy at this moment. I feel like this is part of maybe what my calling was at this very moment, to
Right.
be in this role at this time.
Right. Well, it's always good to see people in the positions happy to do what they're doing, successful at what they're doing, and representing a whole lot more than just themselves. Even if the pressure is not just on you, you still represent a whole lot. So I'm glad to see you guys in those positions. I wonder about the future of mental health in college athletics. You touched on a little bit, Monique, about how people are seeing how important this is. And NCAA, LaKeitha, you mentioned the NCAA has a mandate for services. Where do you guys see it going in 5 to 10 years? I mean, it seems like the community is going in a direction of understanding the importance of mental health and mental wealth. Specifically, when you talk about the African American community, hip hop community, a lot of people are talking about this type of thing. But when you talk about college athletics, where do you guys see this going, and how do you see it expanding?
I hope for the better.
Right.
I hope it continues to be where universities, or our athletics departments, maybe more so, see the need for not having just one person, having a diverse staff. So that was important for me in hiring my staff. I knew I wanted, both differences in gender and age and specialization, in order to be able to provide a wider range of resources for our students to have choice. Because it's hard enough, like we just talked about, for if someone is trying to erase stigma, for them to go in and make that appointment and come in and then have to now get through the hurdle of like, well, will this person get me? And at least if they have options, it provides them with a space to do that. So my hope is that universities will start to think intentionally about who they hire in these roles and what their, expertise is, in order to be able to give students the most choice, so that it doesn't feel as big of a burden to even get started with therapy, and then to see the benefit in their sport performance as a result.
All right, Monique.
Yeah, I still think that there's a lot of stigma that needs to be broken down. My hope is that we continue to move in that direction. One thing that I really like at Baylor is that I'm a part of the health and wellness team. So the rest of my team includes athletic medicine, performance nutrition, strength and conditioning, things that our athletes and our coaches are very familiar with and used to. And sometimes it's helpful for me to just be a part of that team. And I like that. But at some point, if I want to be mental health by myself, an individual unit, I want people to still embrace what we do and make that a normal part of what our athletes or the services that they're utilizing. I mean, I talk to our coaches about how when you're telling our student athletes and talking to them about the services that are available and, what they need to do when they're injured, make sure you're including mental health in that, what they need to do if they're feeling anxious or they're dealing with issues back home, that these are also resources that are available. There's been some research done about if the service is not available to student athletes and if it is not being shared with student athletes that it is available, they tend to think that it's not as important. And so making sure that we are a part of the conversation about resources, about what's important, about what's going to make them successful, and continue in that direction. And because of that, we will continue to grow as departments, because we're going to need more and more staff to be able to do that.
Yeah, it's important. We ran an article on AthleticDirectorU about the perceived barriers that Black student athletes see in terms of mental health services. It talked about stigma, it talked about silence, it talked about the community, it talked about weakness, talked about toughness, it talked about a number of things. They interviewed a number of student athletes on how they feel about it, what their perception on the team is, and obviously it's still there, right? And it's still out there in the community. So you definitely, beyond just Black student athletes, everybody has to realize that it's a benefit and that your mental sanity, right, is very important. And thinking about that, we've been in a lockdown for a couple months now, right? And that, I think, has an effect on all of us, myself included. I wonder about the pandemic, and I wonder about services that were potentially offered over the last few months during lockdown. And then now, as it looks like here in summer 2020, people are returning to campus. Like, are there hesitations in terms of returning to campus? Talk to me about that aspect of, from the staff to the student athletes, the hesitation or anxiety, or what are you guys seeing that you can talk about over the last few months? And then I guess right now at this moment in time, as we're recording this conversation.
It's definitely been interesting. Not what we expected. In late February, early March, in the middle of, ending of basketball seasons and traveling with teams for stuff like that. And then all of a sudden everything is shut down. And so we moved directly into a virtual counseling model. So doing individual and group and team meetings all through Zoom in order to be able to provide that continued service to folks as much as they want or needed it, but also understanding that there was this shift, right? When sport got taken out of the equation for a lot of our students, some of their pressures went away in the sense of like trying to balance school, sport, family. And so there were definitely folks who struggled with identity and things like that being taken away so abruptly, especially if they were still in the middle of their season, like our spring sports, gymnastics, basketball, tennis, golf, like they were in the middle of things. And so to have that taken, you definitely saw some peak moments of anxiety and depression and sadness and just questioning what was going to happen next. And so I'm happy that we were able to kind of jump and respond quickly to move to a model that provided them with continued services, and now work through the last 3 months of doing that. And I mean, Monique and I were just talking about now our teams are coming back, and it's interesting to hear either what they've experienced while being away, but also what fears exist among them, among coaching staff, in order to be able to provide, the safest transition back. So for us right now, we're still, from a clinical perspective, staying in a virtual model just to be able to reduce interaction with one another for now while we test people and do antibody testing and all these other things. So we'll move back to campus eventually, but we're trying to do it in a phased approach just to be able to make things the safest for us. So that's where we are now. And I think, that will continue for as long as we need it to. But I know every state is different. The numbers look different in every state of what that looks like to transition back as far as positives and things like that. So there's a whole bunch of procedures and all that going on too. So I don't know if we'll talk about that soon, but there's a lot involved.
Right. I wonder, did you find that the services that you provide were used more or less frequent during lockdown? Like, was there a change in frequency, I guess, or?
I felt like it was about the same. It didn't feel like more, because again, I think there were those folks who actually got a little bit of a reprieve from sport ending, even though I think in the moment they hated that it ended so abruptly. But by the time they got home and they were with family, it was almost like, man, this is what it feels like in some ways to be a normal student, where I just have to finish out school and, take care of myself physically. But I think being able to recognize that after a while, when your identity is so enmeshed in who you are, it can be tough. And there's grief there, there's loneliness there. So I felt like it was about the same. I do feel like now that we're in the summer that we are busier this summer than in the past summers when things were normal, in whatever normal is now. But right. Being able to see that increase for sure now that people are back, because I think there are concerns about health and safety there, but also now reintegrating yourself back into sport, and what does that look like moving forward into thinking about fall sports. So summer is busier, but I think in the time of the pandemic, we were about the same.
Right, exactly. Now, Monique, what I know about your schedule is that if I try to get you to be on a podcast or video, I have to find the 10 minutes 5 weeks from now on a Wednesday afternoon that you possibly could work. But if a student walks in when we're about to record,
you got to go.
Then we have to restruggle it for 7 weeks later. So I wonder about you in terms of frequency of use during the summer, availability, and I guess picking up now that we're having student athletes return to campus?
Yeah, it's been a little up and down. So when it first happened, there was a lot of shock. I did a lot of sessions where I was helping student athletes figure out how to create a schedule and find some normalcy and get a schedule around their sleep and just really adjust. They're so used to being in such a structured environment. So that was a struggle in the beginning, and then they kind of got through that. And then the end of the semester was approaching, and then our seniors kind of realized that, this is it. Like, this is how their last semester of their college and career ended, and there was some grief in there. And our students have not loved the online academic portion, and so some stresses around academics. So it's been a bit of a roller coaster. Whatever they're experiencing at that time, there's a little bit of peak, and then they learn how to cope with it, and things are going a little better. And so we're back down to maybe fewer sessions a week. Now that they're returning, a lot of them, I'm here, as you can see, in my office. And so our football team is doing their processing, getting their testing, their mental health screen and things like that. And so some of the conversations I've had with them is that some of them thought that, yeah, it was a nice little break, but I'm glad that it's over. I'm ready to be back. There are some that are concerned about coming back, or even concerned about what's still happening back at home, parents laid off, or family situations that are happening back at home. So you get a bit of a range of emotions. There are some that's like, it was a great 3-month break and now I'm glad to be back. And there are some that have found it a little more difficult. One thing that I'm talking to them about is definitely remember that this is a new normal. So you're saying that you're coming back and you're excited to be back and get back in sport, but it's not going to look like what it looked like when you left. And so just remaining flexible in that and not getting so excited and caught up in the fact that you're coming back to what you left, because it's completely different now.
Right. I wonder about that part of it, the hesitation people may have to come back to campus A, and wonder if what they think about being on campus and engaging with people again, right? This is a whole different aspect. It's a whole different life. Now I'm gonna be around potentially 40 to 50 teammates who I've probably talked to and interacted with digitally and maybe worked out with once or twice over lockdown, but now we're all on campus. Now I'm seeing my coaches again in person, possibly here. And so, like, are there a lot of hesitations in that? I mean, tell me about what you're hearing nowadays, I guess.
I think it's a mix of both. I think you are seeing folks who are rarely ready to go because being at home was like not ideal for whatever reason. Just being 18, 19, 20 years old and going back and moving back home when you are used to being away can be tough.
Right.
I think many of them are if they're adjusting from solo quarantining. So we had some students who couldn't go home, some of our international students, and those that maybe they're local to Louisiana, but they wanted to stay in Baton Rouge. And so they just rode this thing out for 3 months in, wherever we let them stay. And they've been by themselves and now have to get back into this routine of weights and all the stuff we've been talking about, and checks and all of these things. And summer school's coming up again too, or it's here. And so I see a mix of both. I see some excitement because I think for a lot of our students, sport means so much to them. It's a huge part of their pride in the university that they attend. It's a big part of who they are. It's family traditions for some of them. And so that part is nice, I think, for them to feel like they're getting that sense of normalcy back. But I think there is some apprehension among some students and maybe even coaches and administrators as well about what will it look like to be back, and what does that mean to leave home again and leave folks behind that maybe have gotten sick and all sorts of things. So I think it's a mix for sure of emotions. I feel like as a staff person myself, I have a mix of emotions. So
Right.
I've seen a little bit of both.
All right, Monique,
Yeah,
different perspective or same?
Yeah, I think it's definitely, we got extremes at both ends. Again, we have some that are ready to be back, ready to jump into it. And for those, we're like, hey, this is still an adjustment period. We know that you're glad to see each other. Don't get together and, be playing video games together all in one apartment or residence hall. Like, you still have the social distance. And then there's some that are a little more concerned. I think some of it has been related to if COVID has affected their family at all, or if they've had any direct connection, even if that's a parent losing a job or anything that has affected their family, they recognize maybe a little more severity and how this is something really serious. And some of those that maybe it has not really affected their life directly in a way, they're like, okay, well, we don't have to shelter in place anymore. We can come back to school. We can come back to sport, which means all is good. And so still having those conversations with them about, yeah, we can come back and we're not sheltering in place anymore, but we're still in a very unknown situation. And so we want to do everything we can to keep everyone safe. So it's definitely both ends of the spectrum.
Right. I wonder, are there generally accepted procedures in terms of returning to campus? Like, is everybody operating from their own book? Has the NCAA or Dr. Heinlein, tell me about that part in terms of mental health when you talk about returning to campus?
I don't know if the NCAA has provided specific guidelines straight with mental health, like directly with mental health. I think in general, the Sports Science Institute, and there was a committee that was put together specifically to address returning. And so those guidelines are ones that I know for sure all of our NCAA schools are expected to be following as far as the personal side of temperature checks and that sort of thing, and social distancing and everything, like Monique said, encouraging students not to, do house parties and play video games and all of that stuff. But then I think there are things on the opposite end of that involve sort of the campus approach to procedures for when a positive comes up and how are you going to handle that. So that was a part of, I think, those guidelines as well. We're doing specific team trainings as teams return, talking to them about COVID specifically, but also, what will that look like if somebody on the team contracts COVID and contact tracing. And so it's a lot involved that doesn't specifically talk about mental health, but for sure, at least at LSU, we've been a part of those conversations and knowing, just like in your last question, there's going to be a mix of emotions of what it means to come back and a mix of experiences based on what people have experienced while they've been gone. And so we've hopefully integrated into that as they make those plans or carry out those plans that the NCAA has offered as guidelines for us.
Right. It seems like if a student athlete ends up positive, which we have seen for this COVID-19 thing, there's a need there for mental health services, possibly depending on how they perceive themselves in this pandemic. Like, are they a victim? Like, what, so I don't know. I wonder, can you even provide services then? Or now this person has to isolate themselves for 14 weeks. And it seems like it's a compounded thing, right? You're bringing them back. I'm back with my team, but now I have to isolate myself. I don't know. There's some intricacies there in terms of mental health, I think, when you talk about those things.
Yeah, we're still providing virtual counseling services. So even if they came back and tested positive and had to go back into a 14-day quarantine, we would provide them mental health services that way. A lot of honestly, what I was doing over the last 3 months was reaching out to student athletes. It wasn't always the fact that they were trying to make an appointment, but me checking in on them and making sure that they're doing okay, because we know that sometimes they're not going to ask for that help and they need someone to reach out to them and see if they're all right. And so with our mental health screenings that we're doing right now, I'm going to follow up with all of them in a couple of weeks and just see how they're adjusting, whether or not there was something on their screening that made me a little concerned about them or not. They're definitely in another huge transition, and it might not be them, it might be a teammate, or again, there's still things happening back home. So we're consistently checking in with them and making sure that they're doing okay and making appointments with them and following up with them. I mean, text, email, just we're using Teams, Zoom, WebEx, all these platforms to make sure we're staying connected, because it's sometimes the athletes that don't reach out that need the additional support.
Yeah, I agree with that, being a former student athlete myself. So, LaKeitha, earlier you mentioned that the NCAA has guidelines, or is it mandates, in terms of requiring mental health services available to student athletes on campus. To educate me a little bit on what those guidelines are in general. And then I guess the question is, are they enough? I mean, obviously, it sounds like they are, on Dr. Heinlein and SSI, they're on the forefront of providing guidelines for returning to campus. But do you think it's enough in terms of, in general, mental health services for student athletes?
I think the guidelines that we have are a great start. So in general, there's kind of 4 things that the NCAA sort of recommends as best practices, which is obviously having the folks who are in our roles, like Monique and I, be licensed clinicians, making sure that those folks have a license in their area of expertise or their clinical approach, like we talked about earlier. I think being able to then know that those folks also should have some experience centered around working with athletes and understanding what does that look like to do so. Then making sure that they are implementing action plans around emergencies. So that's a big piece of it as well, being able to sort of understand what approach to take when something like this happens, and obviously knowing that's going to vary based upon the student athlete themselves. And then being able to be a part of sort of, I don't even know the best, they obviously word them very specifically in the guidelines, but just being able to make sure that we are a part of the conversations around erasing the stigma, being able to be proactive in pushing mental health and requiring departments to sort of make that a priority. And so I do think it's a great start. I think that it obviously is much more than we've had before. I think those guidelines came about in 2016, so that's not very long when you think about it. So the fact that we're in 2020 now and the conversation has grown much larger, and like we've talked about today, with more staff and what does it look like to integrate our teams, and by teams I mean our clinical teams, into the rest of the sort of sport science part of what we do. And so I think it's a great start. I think we still have ways to go. I think there should be probably more guidelines on how to help folks pick the right people for these roles. But I think we've started in a really, really great spot.
Yeah, I think we have to remember that the NCAA, their guidelines go to all member institutions. And so, like we talked about before, what LaKeitha and I can do at Baylor and LSU is different than what other institutions can do. So I think when we think about maybe making them a little more structured or adding to them, I think that the NCAA has been really thoughtful about the fact that resources are different for different places. So even the second guideline about student athletes having access to services, they don't really specify what that looks like, because some people might be able to have someone in-house and some institutions might not be able to do that. So I think it's a good start. I think it is very strategic in the fact that we want every institution to be able to utilize these guidelines, knowing that every institution doesn't have the same amount of resources. So definitely want it to continue to grow and move forward, but having to really think about what that looks like.
Right. Well, this has been an excellent conversation. I'll ask this final question. I'm sorry, one more came to my mind, but you guys being the practitioners, is there anything else that I didn't ask that probably needs to be known in terms of the audience for this video and AthleticDirectorU and people in the college athletics industry?
I think I would just like to see the continued approach like this to talk about mental health in a way that is not intimidating and that makes folks feel that it is just as important of a piece in a student athlete's experience as everything else. So the same way where we really harbor on strength and conditioning and who's the coach that's coming in and all of those things, this plays a really huge part. And I think that, again, we're moving in that direction. We've talked about that this whole time, but
right.
I think just letting folks know that, we all play a part in being able to make mental health as important as the rest of our physical health. It's integrated. And so just being able to continue to have these conversations, prioritize where you can. And if you are at a school that you don't have those resources, knowing what to ask for and knowing who to ask. And so seeking out folks, your peers who are at some of these schools like we are, to ask us, where do we start or how do we start? And being able to just make this something that our students can have easy access to for their entire athletic careers from the beginning. So I just want people to keep the conversation going.
Keep it going. What about you, Monique?
Yeah, I absolutely agree with that. And then I also think that people just need to recognize that the time that we're in, I mean, our student athletes, especially our student athletes of color, are having a difficult time right now. And so making sure we're providing them the support and resources they need, especially considering the fact that we're in this double pandemic, if you could call it that, with COVID
right.
and with the social unrest that's happening. And so they're returning to school and they're returning to sport and they're excited. But just because they look like that on the outside doesn't mean that they're not struggling with this mentally, and it's affecting them in ways that maybe we're not always aware. So making sure that we're caring for our student athletes holistically is really important, especially during difficult times like we're facing right now.
All right. Well, excellent conversation, ladies. I really appreciate you joining us here on Athletic Director U.
Thanks for having us.
Thank you.
That was Dr. Monique Marsh-Bell. She's the Assistant Athletic Director for Mental Health Services at Baylor University, and Dr. LaKeitha Poole, who's the Director of Student Athlete Mental Health at LSU. And of course, I am Ty Brown with AthleticDirectorU. And keep in mind, the role of a leader is to create and maintain an environment that people want to be a part of. And as always, be better tomorrow than you are today.